All right, welcome. Today, we're diving deep into a topic that's absolutely fundamental to metabolic medicine, diabetes mellitus. Now, if you're a final year student, you already know this is a big one. So we're going to slice through the noise and get right to the core concepts you really need to grasp. Let's jump in. Think about that for a second. What really happens? This question gets right to the heart of what diabetes is all about. See, it's not just a sugar problem. It's a catastrophic failure in the most basic system our bodies have for generating energy. And that breakdown, well, it affects literally every single cell. So here's our game plan. First, we'll define the challenge. What exactly is diabetes? Then, we'll pop the hood and look at the inner workings, how it impacts the body. After that, we'll cover diagnosis and then focus on the most powerful management tool there is, diet. And finally, we'll talk about the long-term outlook.
Okay, let's start at the beginning. You can't treat something if you don't truly understand it. So let's get a crystal clear definition of diabetes mellitus. This right here is so crucial. Notice it goes way beyond just carbohydrates. Diabetes is a full-blown metabolic disorder. It disrupts how the body handles all three macronutrients: carbs, proteins, and fats. That's why its impact is so incredibly profound, affecting everything from energy levels to body composition. We're talking about a systemic breakdown. Now, the source material here makes a distinction between two main types. It calls them type A and type B. What it's describing is what we now commonly refer to as type 1 and type 2. Type A, or type 1, usually kicks in at a younger age and absolutely requires insulin. Type B, or type 2, tends to show up later in life, often linked to things like obesity. And making this distinction, it's the very first step in figuring out the right way to manage it.
Okay, let's get into the nitty-gritty. For you, as future healthcare professionals, knowing the how this disease throws the body's entire engine out of sync is absolutely essential for taking care of your patients effectively.
So it all starts here, with the carbs. Glucose, the body's #1 fuel source, just can't get into the cells where it's needed. So what happens? It piles up in the bloodstream. That's hyperglycemia. The kidneys then go into overdrive trying to dump all this excess sugar, which is why you see glucose in the urine or glucosuria. It's a paradox, right? The body is drowning in fuel it can't even use. So when the body can't use glucose, it gets desperate and turns on itself. It actually starts breaking down protein from your muscles, from your organs, just to get some energy. This is what leads to that muscle wasting and something called a negative nitrogen balance. The body is literally consuming its own structure to stay alive.
And the last resort, the final metabolic shift, is to fat. In uncontrolled diabetes, the body starts burning fat at a furious, dangerous pace. The problem is, this process creates acidic byproducts called ketone bodies. As these build up, they can make the blood acidic, leading to a life-threatening condition known as ketoacidosis. And here's where all that internal chaos starts to show up on the outside. Those classic 3 polys are a direct result of everything we just talked about. Polyuria, or frequent urination, that's the kidneys working overtime to flush out sugar. All that fluid loss makes you dehydrated, leading to polydipsia or intense thirst. And even with all that sugar in the blood, the cells are starving, which triggers polyphagia or excessive hunger. And the weight loss and fatigue, well, that's the body burning through its own muscle and fat for fuel. It all connects. So, if a patient presents with these symptoms, how do we actually confirm it? Let's walk through the key tools we use for diagnosis. It's really a multi-pronged attack. You start with a simple urine test, looking for that glucose and those ketones we mentioned. Then you move to blood tests, checking glucose levels both when fasting and after a meal to see how the body is responding. But the gold standard, the real stress test for the system, is the glucose tolerance test, or GTT. It shows you exactly how well or how poorly the body can clear sugar from the blood. Okay, so once the diagnosis is confirmed, the focus shifts to management. And look, while there are a lot of factors, the single most powerful, most fundamental tool in the entire toolkit is diet. It is the cornerstone.
Now hold on, this might actually surprise you. Take a look at that, a really high percentage of carbohydrates. What this tells us is that managing diabetes isn't about cutting out carbs completely. Not at all. It's about controlling the type and the amount. You want a steady, reliable supply of energy from good, complex carbs, balanced out with the right amount of protein and healthy fats. So, the whole dietary strategy really boils down to these four key principles. One, get to and maintain a healthy body weight. This really helps with insulin sensitivity. Two, consistency is everything. Eating at regular times prevents those wild blood sugar swings. Three, make sure you're getting all the nutrients the body needs to function properly. And four, the ultimate goal that ties it all together is achieving stable blood glucose to head off those long-term complications.
And this is where theory becomes reality for a patient. The food exchange system is just brilliant because it gives people power. It allows for flexibility, for variety in their diet, while still keeping a really tight rein on their macros. So, for example, someone can swap out a portion of rice for a slice of bread, or even an idli, and they know they're getting the exact same amount of carbs. This makes the diet livable, and if it's not livable, people just won't stick to it.
So, what's the long-term picture here? Well, managing diabetes is a marathon, not a sprint. And to run that race well, you have to understand exactly what the stakes are.
And the stakes are high. These are the serious, life-altering complications that can happen if diabetes isn't well managed. Consistently high blood sugar is toxic to small blood vessels, which is why you see damage in the eyes, the kidneys, and the nerves. It also puts cardiovascular disease on the fast track. Now, this isn't to scare anyone, but it is to highlight just how incredibly important that day in, day out management really is. Which brings us to what might be the single most important point of this entire discussion. You can have the best diet plans, the best medications, but they're just tools. The true engine of success is the patient themselves, their understanding, their buy-in. Effective education is what turns a diagnosis from a scary label into a manageable plan. So here's the bottom line. Diabetes is not a life sentence. It is a manageable condition. As you step into your careers, never forget the power you have. Your ability to take this complex science and translate it into practical, empowering knowledge for your patients, that's what makes all the difference. So I'll leave you with this question. How are you going to use what you know to turn a diagnosis into a blueprint for a long, healthy life?